Hello everyone, today's session is jejunum to sigmoid colon. I'm going to upload two videos, part 1 and part 2. Part 1 will consist the brief embryology and the gross anatomy. Part 2 will be covering the blood supply, lymphatic drainage, nerve innervation, clinical points and some MCQ questions. This is duodenum, jejunum, and the lower one is ileum. Altogether, we can call it as small intestine. From this, the cecum, appendix, ascending colon, transverse colon, descending colon, sigmoid colon, rectum, and anal canal. These all are large intestinal parts. And also there are other abdominal organs like liver, gallbladder, stomach, esophagus. These all abdominal organs has three main embryological origin. Foregut, midgut and hindgut origin. Foregut origin are esophagus, stomach, proximal duodenum, liver, gallbladder and pancreas. Midgut origin are distal duodenum, jejunum, ileum, cecum, appendix, ascending colon and the right 2/3 of transverse colon. And the hindgut origin, left 1/3 of transverse colon, descending colon, sigmoid colon, rectum and anal canal. As you studied about the foregut in the embryology section of the stomach in the previous video, now I'm going to explain about the midgut and hindgut. Here is a small animated video for easy learning which I get from a YouTube channel. Here you can see the elongation and first 90-degree rotation of the herniated intestinal loop at the 6th week of embryo. Now occurring is the initial return of the herniated intestines and second 90-degree rotation at the 10th week of embryo. Then the third 90-degree rotation of the intestine at the 11th week of embryo. Finally, the descent of the cecum occurs at the later stages in the fetal period. Small intestine consists of duodenum, jejunum, ileum. Duodenum will be explained in separate video. The total length of jejunum and ileum is 4 to 6 meters, and now we are going to see the anatomical features of the jejunum and ileum. Jejunum and ileum exhibit some difference between them in anatomical features. When we see the location, jejunum lies in upper part of infracolic compartment, while ileum lies in lower part of infracolic compartment and as well as in pelvis. Jejunum has less mesenteric fat, while ileum has more fat. Jejunum consists of 2/5 of total length, which is 4 to 6 meters, while ileum consists 3/5 of total length. The Peyer's patches, the aggregated lymphoid follicles, they are the Peyer's patches. They are present in ileum and absent in jejunum. Jejunum has thick wall which feels like double layer, but ileum has thin wall which feels like single layer. Jejunum has wide large lumen than ileum. In this picture, you can clearly see the thick wall and the large lumen of jejunum, and also the thin wall and the small lumen of the ileum. That's all about small intestine. Now we can move to the large intestine. So the parts of large intestine are cecum, appendix, ascending colon, transverse colon, descending colon, sigmoid colon, rectum and anal canal. The rectum and anal canal will be explained in a separate video. We start with cecum. Cecum is a blind pouch which projects downwards. Cecum lies below the ileocecal junction. Here lies the ileocecal valve which prevents the reflux into ileum. Above the ileocecal junction, the ascending colon lies. This picture shows the exact location of the cecum. Cecum lies on the right iliac fossa over the iliacus, lateral femoral cutaneous nerve, femoral nerve and psoas. Cecum completely covered by peritoneum and it has taenia coli. Taenia coli is the longitudinal muscle of colon which is concentrated into 3 flat bands. These are the 3 flat bands of taenia: anterior taenia coli, posterior-medial taenia coli and posterior-lateral taenia coli. These continues throughout the colon. This picture shows the real taenia in human cadaver. And this is a picture of convergence of taenia at the root of appendix. This gives a trefoil appearance. Here you can see the conical shaped infant cecum. During development, the adult will get a bulged cecum. The lateral wall outgrows the medial wall and bulges down below the base of the appendix. When the cecum distended, its anterior surface touches the parietal peritoneum of the anterior abdominal wall. These all about cecum. Appendix extends from the cecum. A vermiform appendix, worm-like structure, blind-ended tube, 6 to 9 centimeters in length. Appendix opens into the posterior-medial wall of the cecum. This is the ileocecal valve. 2 centimeters below this valve, the appendix opens. Appendix lies in various positions. Retrocecal position is the most frequent position. Pelvic position is the second most frequent position. And also there are retrocolic position, retroileal position and also paracecal position. Lumen of the appendix is wider in young child while narrow in adult. Subsequently, it can be obliterated in the elderly people. Appendix has its own mesentery called mesoappendix. Peritoneum of the cecum reflected downwards to the floor of the right iliac fossa, forming a space, retrocecal recess. Appendix may be lie here. Ileocecal fold attaching ileum to cecum. Between this fold and mesoappendix, there is a space called inferior ileocecal recess. There is a vascular fold lies in front of the terminal ileum. Behind this fold, there is also a space called superior ileocecal recess. Okay, now we move on to the colon. This is ascending colon, transverse colon, descending colon and the sigmoid colon. The total length of ascending colon is 15 centimeter. For the transverse colon is 50 centimeter, descending colon 25 centimeter and the sigmoid colon 40 centimeter. Ascending colon extends from the ileocecal junction to the right colic or hepatic flexure. The transverse colon extends from hepatic flexure to the splenic flexure. The descending colon extends from the splenic flexure to the pelvic brim. Sigmoid colon extends from pelvic brim to the commencement of the rectum in front of the S3. Ascending colon lies on right iliac fascia and lumbar fascia. Descending colon lies on left lumbar fascia and iliac fascia. The transverse colon lies on coils of small intestine, jejunum and ileum. Sigmoid colon lies on the rectum and the peritoneal surface of the bladder and uterus. These are the appendices epiploicae, small pouches of peritoneum distended with fat. Throughout the colon it presents, but the quantity differs. Ascending colon has a number of appendices epiploicae, but transverse colon has numerous than ascending colon and also larger in size. Descending colon also has numerous appendices epiploicae. Sigmoid colon has well developed appendices epiploicae. This is the transverse mesocolon and this is the sigmoid mesocolon. This is a picture from a human cadaver, transverse mesocolon, and this is sigmoid mesocolon. So, transverse colon and sigmoid colon have their own mesentery. So, they are intraperitoneal. But ascending colon and descending colon are retroperitoneal. They don't have their mesentery. Here in this picture, you can clearly identify the hepatic flexure and splenic flexure, and you can see the relations between other abdominal organs to these flexures. You can see here that the hepatic flexure is lying little bit down to the splenic flexure, because here lies the liver. Due to the liver, the hepatic flexure lies little bit lower than the splenic flexure. This is the phrenicocholic ligament which attaches the splenic flexure to the diaphragm. Here lies the pancreaticocholic ligament which attaches pancreas to the colon, and also splenicocholic ligament which attaches spleen to the colon, and also the phrenicocholic ligament. This is the gastrocolic ligament, a part of greater omentum which connects the stomach to the transverse colon. Two paracolic gutters, the right paracolic gutter which runs laterally to the ascending colon, as well as the left paracolic gutter which runs laterally to the descending colon. And that's the end of today's session. Thank you so much for listening, guys. Please do subscribe and keep supporting us.